Okay, so this is the today's presentation for the prostate health. Okay, before I start, I greet everyone. I greet everybody, and even though I am not in the UK at the moment, but I'm with you guys in the spirit. You see, okay? So, talking about the prostate health. Prostate is a very vital organ in the body for men. So it plays a very vital, role in reproductive health of men. So, and then of course it's an organ that is also very, very important in terms of sexuality of men and also reproduction. So we'll be looking more into the health matters, concerning the prostate. So there are different ailments that we know prostate, um, like benign prostatic hyperplasia, prostate cancer, and prostatitis. So we'll be talking about these things one after the other. But I want us to know that prostate is very vital in reproductive health of men. Now, any man can survive without the prostate. It's even though it's a vital organ, but people, can survive without the prostate. So now, what are the functions of the prostate? Now, one of the function of the prostate is that it produces fluid. Called the component of the semen. So this helps in making the sperm cells that is being produced to be viable, and then sperm can freely swim in the semen. So, and then again, prostate is also act like a muscle. Okay, it contracts during sexual intercourse. Prostate contracts, and with that forceful force, it pushes both the semen that is being produced, and then also the sperm that is produced from your testes, pushes them into the urethra, and from there the ejaculation. So that's what the orgasm, or the climax in sexual intercourse is. So that is what the function of the prostate is, you see. So it also plays very, very much in sexual health of men. So we'll be talking about how to look after this prostate, and then how to identify any ailment and then seek help timely. So another function of prostate is that it produces a fluid or a protein called prostatic specific antigen. So it's a protein. So this protein is being produced by the prostate. So sometimes this protein can also be, be used for screening purposes, though, even though it's not ideal, but we'll be talking about that later. So what this antigen or this protein does is that it keeps the semen liquefied. So instead of making it clunky, that it cannot move freely and then kind of freezing up the sperm, the PSA helps the semen to keep them liquefied and helps the semen to flow, the sperm to flow freely. So that's also one of the functions of the prostate. Now, the prostate, like we said earlier, it supports the male reproductive health. Okay, so if you look at this diagram, you can see the prostate here. Okay, you can see the prostate here, so I'm pointing. Now this is the bladder. So in proximity, we'll also be seeing how this position of the prostate relates to other surrounding organs when this prostate is faulty. Now, what are the common prostate health issues? So I grouped them in three categories. These are quite, the commonest prostate issues that we see. But the commonest is the benign prostatic hyperplasia, what we call BPH for short. So these these are non-cancerous enlargement, it's common with age. Okay, so men over 50 usually come down with this enlargement. So it's like the prostate growing with activity and then growing with age. Also, there is also prostate cancer. Okay, so which is also, it is the most common type of cancer in men. Okay, it can be it can be kind of indolent, it can be aggressive. So it's very important to be able to identify this, because that early identification will lead to ultimate treatment and an ultimate cure. So another disease or the health issues concerning the prostate is prostatitis. Now, this is quite common in younger people because of inactivity. There are a lot of things that can cause this, but these are quite common in younger people because of inactivity, especially in this more modern age. People do office work, sit down for quite a lot lots of time, and all those stuff. So it typically means inflammation of the prostate. Okay, so prostate gets swollen, enlarged, and becomes irritable. Now we'll be talking about these common health prostate issues in details. Um, First of all is benign prostatic hyperplasia. So if you look at this diagram, you can see this is a normal prostate, and this is a prostate that is enlarged, that has grown out of proportion. So this is hyperplasia, benign prostatic hyperplasia, BPH for short. Now, if you look at this diagram, you can see here that this prostate, as prostate organ as it is, has a very kind of acts like a gateway to the ureter, which is to the urethra, which is the outlet of urine from the bladder. Now, look at this bladder area, the bladder, the inside of the bladder. Now, when there is prostatic hyperplasia, it clogs up and closes the gates. That means compressing the outlet of the bladder, okay, such that the urine could no longer flow. Even if it flows, there will be some issues, like we'll be seeing in some of the symptoms pertaining to this prostate disease. Now, so this in itself is not a cancer, okay? It's just enlargement. Now, it's kind of in terms of prevalence, it's 60% of men, common in 60% of men over 60 years. Prostate, you see how common this is. This is 60% of men over 60 years. So that's quite significant. And then also, whereas as age increases, it increases up to 90%. So it's present in 90% of men over age 85. Okay. Now, there are different, theories or hypotheses of cause of the BPH, okay, enlargement of the prostate. So, but this is, like I mentioned earlier, this is a normal, this is not, is benign, what we call benign. It is not serious, it is not cancerous. So it's a growth of normal prostate cells with age. So growth of normal prostate cells with age. So, and it has to do with hormone changes, hormone changes in later years, like testosterone, changing to dihydrotestosterone, and then, as the case may be, with the advance in age. Also, we can also see about the risk factors, what predisposes one to having BPH. Okay, what predisposes one to having BPH? So one is obesity. So if you are overweight, what we term obesity is any weight over BMI of 30, BMI of 30, okay? So And what is BMI? It's a kind of a function of weight and the height. So if you are overweight, okay, if you're a man, depending on your height, you calculate your BMI. It's easy to calculate BMI on with modern devices nowadays. You just open up, calculating the BMI. So you put on your weight, put on your height. If the summation of your calculation is over 30, then that is obesity. Okay, so that's obesity. So now obesity is also a risk factor for BPH, and now obesity is also a risk factor for so many medical conditions, regarding cardiovascular health, and then also um, 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 cancers, is also linked to, causative or risk factor for some form of cancers. So as men, especially, ourselves that are almost everybody is heading, we are just like moving towards 40, you know. As a matter of fact, all of us are in midterm, what we call midterm age men. So we are in middle life. So we all need to be very careful with our weight and with everything, activities, exercises, our diets, in order to help to maintain a normal weight. So obesity is linked to many health condition. So BPH is one of it. Another risk factor for BPH is high saturated fats. Okay, high saturated fat. In as much as also high saturated fat, high saturated fat diet is also not good for health. It increases your cholesterol, which also impacts on your cardiac health. It's also a risk factor here. Okay, so again, our diet is very important. And then also low physical activity. I mean, low physical exercise. Okay, especially in this modern time. If you go to work, maybe you're coming back. Time we must have to find a way to exercise ourselves. Active physical exercises. Okay, it's because low physical activity, exercise is also a risk factor for BPH, as well as a risk factor for other things. Okay. Now, alcohol intake is also a risk factor for BPH. Alcohol intake is a risk factor for BPH. So now we haven't seen the prevalence, the causes, and the risk factor, for benign prostatic hyperplasia. Now let's look at the symptoms of this BPH. So the symptoms of BPH, I, categorize them into three functions. Okay. One, remember with the anatomy, anatomy is where how the prostate is situated in the body. From the anatomy of prostate, if it has trouble, if it has problem, in case of enlargement, it will affect the surrounding organs, the urethra, the bladder, so all these things. So we see the effect or the symptoms, deduced from that, enlargement of the prostate. So one of those is urinary function. Of course, we see that the prostate is very close to the bladder and then straddled between the urethra. So if there is enlargement of the prostate, first thing we will see is urinary symptoms. Okay, lower urinary tract symptoms. Okay, so which I use the acronym FONWISE to. So the FONWISE means F is frequency. So if you're passing much urine, if you just passing urine maybe every hour, you find out that your frequency of passing urine has increased over time. Okay, and then also it can also cause what we call urgency. So if you are in occasions maybe and you're feeling pressed to pass urine, you cannot hold your urine. Though so many of us may have seen our parents or some other people that maybe in occasion they see they wet themselves. So it's quite embarrassing moment, okay? It's quite embarrassing moment. And it's quite an embarrassing incident. So people, sometimes people, when going for occasions, or they're afraid of going for occasions, or while going for occasion, they wear, adult pampers in order to prevent that embarrassment. So urgency, inability to hold your urine for too long or for how you want to hold it. Okay, so anytime you feel pressed, you have to go. If not, you have to watch yourself. So that is a symptom of BPH, urinary urgency. Also, nocturia. So this is quite troublesome. This one, nocturia. Nocturia is waking up frequently at night to urinate. Of course, you agree with me that if somebody wakes up frequently at night, like 2, 3 times, or even 4 times, up to 5 times at night to pass urine, of course, the quality of sleep will not be good at all. So, and of course, that will affect the person's daily output, in terms of function during the day. So, and then of course, it will also affect the cardiovascular health because of poor sleep, lack of sleep, and other things in the body. So, nocturia is also a symptom of prostate. So, why I'm emphasizing on this symptom is for us to know, even though BPH is not cancerous, but the symptoms are quite troublesome. It's something that can change one's life. So, another symptom of BPH is weak stream of urine. So instead of urine to be kind of flowing, like maybe using your urine to draw map of Africa on the floor, it's now dribbling. Okay, it's now kind of a little bit coming out less forceful. So that's also another symptom of prostate BPH. Another thing is intermittency. You want to start passing urine. If you go to the toilet to pass urine, it will start and stop, start and stop. So that's also a symptom. And then also straining. If you want to pass urine, you have to put in much pressure to be able to force it out. And the last is, if you go to pass urine, after passing urine, you know that you have not finished passing urine, but urine won't come. So what we call feeling of incomplete emptying of your bladder. So that is, after passing urine, you feel that, oh, there's still some left in your bladder. So that is also a symptom of BPH. Okay. Now, these lower urinary tract symptoms can also be symptom of urine infection. Okay, it can also be a symptom of urine infection, but you see the weak stream, you see the intermittency, the straining, and the feeling of incomplete emptying. They are not symptoms of urine infection. They are classically symptoms of benign prostatic hyperplasia. Okay. Now, another symptom of BPH is erectile dysfunction. Okay, erectile dysfunction, because as the prostate is growing too big, okay, it may not be coordinated in terms of the in terms of this the spasticity, maybe during the ejaculation, and of course it will also impact on the ensuring maintaining and the achieving erection and maintaining erection. So that's also a symptom of BPH, okay, commonly associated with BPH. Now, another impact or another symptom of BPH is the impact on the kidney. Okay, when there is urine retention, the prostate is so enlarged, blocking the outlet of the bladder, which is the urethra, and then the urine cannot flow out again. Then there will be backward pressure. So instead of urine now coming out, urine from the bladder will start, bladder may be filled up, okay, because each time you urinate, there's still much residual urine in the bladder that should have gone out, but because of the enlargement, the urine, didn't come out. So it will keep on adding. Now, it comes to a point whereby either that the prostate is completely swollen and the closing of the urine outlet completely, okay, or there is much accumulative urine, residual urine in the bladder. It will generate a backward pressure to the kidneys. Of course, that backward pressure to the kidneys is not good for the kidney. Kidney does not like pressure. So that's also one of the symptom of BPH. So, but this symptom is just, this kidney impact is late symptom, okay, late symptom. And of course, more so, you don't see the kidney impact. You only see the outlet, the retention. And then one of the classical symptom of retention is that the person will not pass urine. The person will be pressed, will want to pass urine, but nothing will come out. And then also, the person will be in terrible pain. There is no pain, some people will try to relate the pain with the pain of labor, because it's very terrible pain. You want to pass urine, but urine could not come out. So the treatment for that is, of course, we end up in emergency for catheterization to relieve the pressure. So now, what are the prevention and treatment of BPH? Now, we have seen the effects. We have seen what BPH is and the symptoms, which are the effects of BPH. So how can we prevent this? And how can we treat it? Okay. I'm not saying that, of course, um, um, like I said earlier, all of us are heading towards the 40s. But with time, if Christ tarries, we still, 50, 60, of course, we start entering into, later life. Then, so we have to have an idea about this, what to do to prevent, because anything we do now will wait for us in those years. So what to do to prevent it, and how do we treat BPH? Okay. So one is lifestyle changes. So lifestyle changes involves what you discussed earlier about the risk. Remember the risk of BPH. So lifestyle changes, it does not only help prevention of BPH or treatment of prevention of BPH as per se, but it helps our general life. I thank God that my friend Dubem Obidina, Dr. Dubem, will be talking about um, like health coach for middle-aged men into the later part of life. So we should also know that anything we do now with our body, with our system, will wait for us in those years. So that's why lifestyle modification is very, very important, because it forms the core, the core form of preventive health, because the health sector is drifting, very, very swiftly now to preventative health. So weight loss management. So knowing our BMIs, knowing our weight, and then not everything we see that we eat. Knowing our weight, knowing, weight loss, exercises, healthy dietary modifications, ensuring, looking at our portion control, things like that. Okay, exercing regularly. Now, exercise, at least 30 minutes of moderate intensity exercises 5 times a week, five days a week, 30 minutes of moderate intensity exercises. Brisk walking is one of the moderate intensity exercises. Okay, at least 5 days a week. Okay, so if you are doing intense exercise now, okay, you can go, you can do up to like 3 or 4 days a week, but exercise is very, very important. Okay, of course, it's also very important for weight loss. Now, like we saw, one of the risks of BPH is high fat diet. So high fat diet involves beef, is a very, very huge source of cholesterol, high fat. Okay. So healthy plant-based diet will suffice, in terms of prevention of BPH and also prevention of other, risk of high cholesterol regarding coronary artery disease and all. Okay. Now, also in terms of preventative health, okay, reduce alcohol intake. Okay. So now, talking about, the prostate health, now looking at mild symptoms, kind of prevention or treatment of mild symptoms, okay? So we start with fluid restriction, okay? So fluid restriction is reducing the fluid you are taking, especially from 6 p.m. to 7 p.m. Okay, because of if you take much fluid, of course, the more nocturia, the more, number of times you wake up at night to pass urine, and avoid diuretics. Diuretics are drugs that can make you to urinate quite often. Okay. Then pelvic floor exercises. Pelvic floor exercises also helps. Okay, it helps to maintain the integrity of the prostate. Now, when the symptoms of BPH is now severe, okay, then we resort to medications. Medication, all right? So one of the medication that the doctors will be, we start with is what we call the alpha blockers, okay? So what the medication does is that it will help to open up or relax the neck of the bladder. You saw how clunky the prostate was looking in the picture I showed earlier. Okay, this picture I showed earlier, how clunky this prostate was looking. Okay, now this is entirely blocked. So you saw this area of the bladder. This is kind of a lot has loss of muscle. Okay, so because of this clunkiness, then there is no outflow of urine here. So what that medication does is that it will relax the neck of this tight muscle here, to relax the neck, and then by relaxing it, it will open up the prostate. It will open up this channel a little bit more, such that the urine can flow. Okay, so it just like it's not curative. Okay, it just kind of to make things easy, open up the bladder neck, and then urine can flow. And then another thing to do, or another medication, is what we call 5-FTR reductase inhibitors. Okay, that medication, what it does, it helps to shrink the prostate. It helps to shrink the prostate. So it helps to kind of reduce the conversion of that testosterone to DHT. That we saw the cause of BPH is the dihydrotestosterone function, the testosterone that is available later in later age. Okay, it reduces that conversion of testosterone to DHT, and that DHT is what causes the enlargement. So in that way, it suffocates or it starves the prostate cells, so they don't get enough DHT to feed them, and that in other words, they will start shrinking. That's what 5-FTR reductase inhibitors, the medication, do. Example is finasteride. Okay, finasteride, dutasteride. So, but this medication, in as much as it's helping to reduce the prostate size, it can also impact on sexual function. Okay, it can impact on sexual function. Okay, now the ultimate treatment for BPH, if all these fail, is surgery. Surgery. So surgery involves, is kind of nowadays is kind of modified. Okay, it's a simple surgery to help to shrunk out the prostate. We call it transurethral resection of the prostate top. Okay, so, and there are other forms, or other modalities, a lot of inventions are coming in this regard. So, and the prostate is removed, okay, in order to allow urine, to allow urine to flow freely and then stop the. So now BPH does not cause painful urination, okay? BPH, it does not cause painful urinations. So whenever you see painful urination, okay, you know that the BPH is being complicated by what? By bacteria, and that is urine infection, okay? Because the BPH is a risk for urine infection because urine is not flowing. So it has creates a lot of milieu, lot of time for the urine to be infected. So anytime, and then that's quite common with men that has BPH, especially in advanced ones. So they always come with recurrent urine infections. Okay, it's not caused by BPH. Any painful urination is caused by urine infection. So now, enough of BPH. Now let's go over to prostate cancer. Now let's look at the overview of the prostate cancer. The overview of the prostate cancer. So now, if you look at this drawing here, so you can see, again, you can see the prostate here. And then this is the bladder, okay? So now if you look at here, this is what prostate cancer looks like in the prostate in situ. Now, this prostate cancer is quite the most common cancer in men. Approximately 1 in 5 men are affected, okay? And it's quite common. It's quite common in dark-skinned men. It's quite common in dark-skinned men, okay? So the growth pattern is that it can be slow. It can be kind of slow growing, but it can also be aggressive, especially if the cancer is detected earlier in life, it can be aggressive. But in the cancers that are detected in the older men, like in men in 80s, most of them are quite slow growing. So sometimes when we look at the treatment, those ones are the ones that we wash away because eventually those men will die of something else and not because of that cancer. Okay, so but for a younger person, now we are talking about somebody in 40s and 50s with prostate cancer, is almost an aggressive form of the cancer. So it needs, radical treatment. Okay. So now the risk group, like I've mentioned earlier, why it's more common in Black men and older age group. Now, looking at the prostate, the prostate cancer and the stages. So let's look at the staging of the prostate cancer. One is local growth. So when the cancer cells, so this is the normal prostate. Oh, this is the stage 1. So you can see the cancer cells. When the cancer cell is only confined in the prostate, it doesn't go anywhere. It's only seen in the prostate. It has not, not gone beyond the boundaries of the prostate. So that is stage 1. Now, stage 2, I'm talking about these risk stages because it will help us to look at the treatment options. Okay. Now, the stage 2 form of the stage 2 cancer is a larger one that has grown and then also distorts the morphology of the prostate, the anatomy of the prostate. So it has grown, like kind of causing some bumps. So these ones are quite difficult to identify. When you do a prostate digital rectal examination, you may hardly find this one. But these ones, when you do a digital rectal examination, you may always find this one because they are now choking out what we call nodules. Okay, when we examine the prostate, you can now feel the nodules from the back passage when we do the examination because they are now kind of distorting the morphology, the anatomy of the prostate. Okay, so Now, stage 3 is the one that has gone beyond the prostate. They have finished distorting the anatomy of the prostate and they have gone outside of the prostate to other organs. Okay? They have gone outside of the prostate to other organs. So this is stage 3. So now the stage 4 is the ones that has not only they have gone outside of the adjoining organs relating to the prostate, but they have also gone far. So this stage 4 is the ones that usually can see in the liver, see in the lungs, different places, see in the bones. Bones is one of the primary area whereby the metastasis of the prostate cancer happens, especially the bones of the spine. Okay, so now talking about risk factor for prostate cancer, okay, is also genetically modified, just like breast cancer in women. So there's what we call BRCA1 and BRCA2 gene. These are cancer oncogenes, gene cells. Okay, so anybody that has this BRCA1 and BRCA2 gene, especially in women, they are almost always worried about breast cancer, ovarian cancer, things like that. So a man that has BRCA1 and BRCA2 gene, prostate cancer. So this is a risk factor. Again, the risk factor of prostate cancer. Okay, just a second. Let me get just a second. Okay. So, the talking about, sorry about the brief in the breaking transmission. Okay. So regarding about the risk factors, okay, we talked about the genetic component, the genetic risk factor, and then we also see age. Age, men greater than 65, they also have risk factor for prostate cancer. Okay, again, black race, dark-skinned men, black men, okay, has also a greater chance of risk factor. Now, prostate cancer is now quite common these days. Okay, even as much as it's the most common cancer in men, it's now quite common than it was years ago. And that's why you may see many outreaches or many public enlightenment about this prostate cancer. So early detection is the ultimate, and early detection is the target, because if you detect that early, the greater the chances, the chances of cure is almost like 100%. So if you detect that in stage 1 or stage 2, okay, other than stage 3, stage 4, all right. Now, another risk factor in prostate cancer is high red meat and fat diet. High red meat and fat diet. Of course, eating unkobi and the isiewu, all those high red meat and fat diet. So, of course, like I mentioned earlier, red meat is also one of the major contributors of cholesterol. Okay, again, as you see here, another risk factor is obesity. You see, obesity is not a threat to prostate health. We saw that in BPH. We are also seeing that again in prostate cancer. Obesity is not a friend to prostate health. And then BPH is not a precursor for prostate cancer. BPH is not a precursor. What I mean by precursor, it's not anyone that has BPH will have breast cancer. That will have prostate cancer. Okay, so BPH and prostate cancer are two different things. They are not related at all. Now, what are the prostate cancer screening tool and treatment? Okay, like I mentioned earlier, when we are talking about the functions of the prostate, we saw that prostate also produces PSA. PSA is an antigen, prostate-specific antigen. Okay, it's an antigen, it's a protein that is being produced by the prostate. Now, this protein, if it is too much, if this protein is too much, it will leak into the blood. Okay, it will leak into the bloodstream, and then when it's too much, leaks into the bloodstream, of course, it will be quite detectable in the bloodstream. Now, it's detectable in the bloodstream, but it should not cross a certain threshold. So if it crosses a certain threshold, then we know that something is going on with the prostate, and we start, doing some investigations. Now, screening tools involve PSA, and PSA is not quite reliable. It is not reliable at all because there are a lot of variables, like we saw. BPH, in BPH, PSA can be high. Okay, in BPH, PSA can be high because it's a protein that is being produced by the prostate. And then if there is prostate enlargement, if there is anything that is causing incessant growth of the prostate cells or prostate abnormal cells, in this case, cancer, both of them will increase the PSA, okay? But prostate abnormal cell, which is cancer, increases PSA more than BPH, okay? And now, other things can also affect the can affect the PSA, okay? Other things can affect the prostate-specific antigen in things like infection. If there is prostatitis that I will be seeing later, then PSA will be high. If there is urine infection, PSA will be high. If there is exercise, even as common as brisk walking, 48 hours before the test, before the PSA test, it will be high. If there is ejaculation, 48 hours before the blood test, PSA will be high. So because it has so many confounders, a lot of things can change the variability of the PSA. So that's why it's not reliable. If not, it would have been the global prostate cancer screening. Any man will be going to have the PSA every 6 months or every year. Okay, but because it is not reliable, a lot of things can confuse it and change can vary it. So that's why it is not reliable. So, but in screening, there are two tools we use. PSA, even though it's not reliable, but it is kind of guiding. It guides you to know when you need to do some more. And then also digital rectal examination. So digital rectal examination is checking the prostate. So, you will see a doctor, and the doctor will position you, how to examine the prostate, and then with the gloved finger, lubricated finger of the doctor, they'll put into your buttocks, okay, into your anus, anal canal, to have a feel of the prostate. So the feel of the prostate will determine whether the prostate is big, okay, whether the prostate is big, or whether if the prostate is big, are there nodules? Are there nodules, something you can feel that is not normal on the prostate? So these are quite, suggestive, okay? And then when that is done, if both the PSA is high and digital rectal examination suggests, nodularity of the prostate, then your doctor, your primary care physician, or your doctor can refer you for further treatment, for further investigations, okay? And those investigations involve, MRI scan of the prostate or a prostate biopsy. MRI scan of the prostate or a prostate biopsy, okay? So When you do the MRI of the prostate, will be able to identify if there is any abnormal tumor cells in the prostate, and then the extent to where it had gone, whether it's stage 1, whether it's stage 2, stage 3, stage 4, because this will inform the treatment of the prostate of the prostate cancer. Okay. Now, prostate biopsy is quite, if the MRI suggests or sees any abnormal cells, of course, that will progress to prostate biopsy. Prostate biopsy is a painless procedure whereby some prostate needle, prostate biopsy needle will be put through your back, through your anus, to have a pinch of the prostate cell to take to the lab and grow it. Okay, so that we kind of, we call it histology, to know the type of cancer, whether it's the aggressive form or non-aggressive form, because that ultimately also will inform the treatment. Okay, now, looking at the treatment of prostate cancer, one is active surveillance, whereby we are not going to do anything, no treatment, no surgeries, just to continue to monitor. In this case, you may be asked to be checking your PSA every 6 months or every 12 months, as the case may be, or every quarter, as the case may be. And then if it is greater than some certain threshold, okay, then you report back for, further investigation. So this is active management, but this active management is is more adopted in older people, especially somebody that is 85 years old or 90 years old with prostate cancer. You can't do anything for the person. Even if you want to do the surgery, the person may not carry the stress of the surgery. Okay. And even if you want to give chemotherapy or radiation, the person may not be too well to carry the stress of those treatments, because those treatments are very stressful. Okay. So now, the active surveillance comes into play. Let us watch and wait and now monitor. We monitor and be seeing to know if anything will need to be done. Okay. All right. So, but in most cases, the cancer will not be the thing that will kill those ones. They will not kill the patient, but they may die from something else that is not cancer. So that's where active surveillance comes in. Okay. Another treatment option is this one. I put it in here because it's also preventative health behavior changes. Health behavior changes, that is a treatment. If you are kind of, cancer feeds, prostate cancer, the risk factors of prostate cancer, exercise, lack of exercise and activity, red meat, obesity, things like that, alcohol consumption, excess alcohol intake. These are things that needs to be changed, especially in active surveillance stage. And then also there is surgery and radiotherapy. Okay, in younger people, of course, surgery is also one of the the first line: surgical, radiation, adjuvant radiotherapy, or chemotherapy. Okay, so surgery and radiation therapy. All right. So surgery, the whole of the prostate is taken out. Okay. Prostate, everything is taken out, and then also radiation therapy. There's some complications of radiation therapy which we'll not go into discussing, and also complications of the surgery which we'll not go into discussing. Okay, today. So, and then also hormone therapy. Hormone therapy is because we saw that prostate cancer is also caused by, mutation or change of active testosterone to dihydrotestosterone. Okay, so the essence of hormone therapy is to stop the body from producing what? Testosterone, because testosterone feeds the prostate. So when the body, when the person is stopped from, of course, the sexual function is gone. There may be some feminization, symptoms. Okay, but this is, of course, when you are choosing the risk benefit ratio, the benefit here outweighs the risk. Okay, so hormone therapy and chemotherapy. Chemotherapy, involves, some medications, use of other medication, not hormonal, use of other medication to be able to treat the cancer. So these hormone therapy and chemotherapy are adopted when the cancer has metastasized. Okay, so that's for prostate cancer. Okay, now talking about prostatitis. So this is the third common illness of the prostate, prostatitis. Prostatitis. So prostatitis, as the name sounds, is inflammation of the prostate. So prostate gets too much swollen. Okay. Sometimes it can be caused by bacteria. Sometimes it may not be caused by bacteria. So sometimes it may be caused by inflammatory changes in the body. Okay. So inflammation causing pain and urinary difficulty. So the symptoms of prostatitis are also symptoms of BPH. Okay. You see the frequency, the frequency, the urgency, the nocturia, the weak stream, the intermittency, the straining, and the empty, feeling of incomplete emptying. Okay. And then also, in addition to prostatitis, there may be also hematospermia, what we call bloody sperm, blood in sperm. Because if the prostate is enlarged or is got, is swollen, what we call a prostate matter is as, is swollen. So it's bulky, bulbous, and swollen. And also the blood vessels supplying it will also be swollen and fragile. So when there is ejaculation, when there is sexual intercourse, leading to climax, the ejaculation, those swollen glands will also contract. And when they contract, some of the blood vessels, tiny blood vessels that are already irritated, will burst open and release some blood in the sperm. So that is hematospermia. You see, you may hear some of your friends say, oh, now I passed blood in my sperm or something. That is a symptom of prostatitis. Okay, it is not entirely caused by bacteria. Okay, it's not entirely caused by bacteria, but it can also be caused by bacteria. And if it's caused by bacteria, it needs aggressive treatment with antibiotics. So you need to see your doctor. So the symptoms of prostatitis includes pain, serious pain on the groin area. Okay, especially when you sit down, you may be feeling pain, radiating to your scrotum or to the tip of your penis, to your tip of your penis. Okay, and then it can be very painful. Okay, so there are types of prostatitis. One is, like I mentioned earlier, acute bacterial. This needs aggressive antibiotics. Okay, aggressive antibiotics because it's very difficult to treat. It's very difficult to treat if it is chronic bacteria. Very difficult to treat because it will keep coming back. If it's not properly treated at the first time. It will keep coming back, and it can disrupt your activities of daily living. Okay, and leading to complication. Another type, the worst type, which is chronic regional pain syndrome. Chronic regional pain syndrome. Now, like I mentioned, prostatitis can be caused by bacteria. And where did that bacteria come from? Bacteria come from urinary tract infection that is not well treated. So there will be ascending infection. So the not ascending infection in this case, the bacteria from the urinary tract will seed into the prostate. And when it seeds into the prostate, it's difficult to treat. So whenever you notice, pain when you're sitting down, pain passing urine. So how to differentiate that between urine infection? Pain while sitting down, pain while passing urine, hematospermia, painful ejaculation, very painful ejaculation because, of course, something that is swollen, squeezing in terms of during orgasm, it will be very painful. So these are, the telltale signs to tell you that this is not urine infection anymore. This is prostatitis and needs active treatment. Okay. So now, there are also, having said that, there are also other causes of prostatitis that are not bacterial cause. Things like systemic inflammation, like somebody that has, irritable bowel, inflammatory bowel disease, okay, like Crohn's disease, ulcerative colitis, even some form of, and then also what we call the type A men, people that are very active. So these are where it, have to impact working class people. Active, very active, always sitting down, not moving around, all those things. So that can also be a risk factor and a trigger. Okay. So, I mean, having said that, we saw that there are three common causes or three ailments of the prostate. One is BPH, second is prostate cancer, and then last but not the least is the prostatitis. Okay. So in all this, early detection of prostatitis, early detection of prostate cancer is the best possible, is the best step to a complete cure. Okay. But for BPH, there are things to do and things not to do in order to make sure that we don't enter, like we saw in the prevalence, 60% of men over 65, 90% of men over 85. Okay. Okay. There are some people that they don't know what BPH is. Okay. So maybe through the modification of their risk factors, they reduce their risk factors to the barest minimum. So let's look after our prostate health because we are getting to that stage. So let us be conscious of our prostate health. Ensure that you are exercise actively. Even if you don't have time, you can get a treadmill in your house. Ensure that you exercise actively. And then look into your diet. Not everything that you will eat, especially we are at advancing age. Unless you are among us and you are in the 20s, then of course you are free to still experiment some more. But if you are over 35, this is a time to be very careful with your exercises, with your diet, and with everything that concerns you for a better evening of your life. So, in conclusion, what's good for the heart is also good for the prostate. Exercises, weight reduction, weight management, healthy diet, less fat diet, they are both good for the heart and are good for the prostate. So whatever that is good for the heart is also good for the prostate. Dalomo, thank you. Now this is the end of the presentation. Thank you.